Thanks so much for being here. Thank you, Josh, of course. So great session so far. We've had a amazing week, exhausting week, and I hope that many of you have been with us for most, if not all of it, but it's been a lot of stuff. I'm so pleased that we're going to be able to wrap here with Roy Schoenberg, who is the co-CEO of Amwell, a company that until recently was known as American Well, and is truly a colossus of telemedicine. It was launched in 2008, and now it represents, it works with 240 health systems, which include 2,000 hospitals, but it also works on the other side of the equation with insurers, 55 different health plans, and many employees coming through those. So, Roy, thank you so much for being here. And tell us, how has COVID changed what you do? Could you just start with that, and then we can back up and talk the history of Amwell a little bit.
Wow, first of all, thank you, David. Thank you for having me. And it's great to be here. It's a tough thing to follow, the conversation that preceded us. But I'll start in saying, the answer to your question, telehealth is the way for the healthcare system to operate without people physically getting in front of each other, without doctors and patients, orchestrating live touch between them, which has become the name of the game for everything COVID, right? I mean, even following the previous conversation, it has become really an incredible change, because it's not only that the volumes, which I'm sure we'll talk a little bit about, it's not only that the volume catapulted into a whole different number of digits and logarithmically, it's also that the inclination of the people involved, both physicians and patients, to start using technology to get with one another has completely rewritten itself, something that didn't happen for over a decade, since the early days of telehealth, has almost happened overnight. And it's just been a fascinating transformation to follow.
Yeah, you worked for 13 years and then you grew up overnight practically. I mean, you obviously had a lot of relationships, you were doing great, but wow. So talk about how it has exploded. You 40 times more visits, is that the right number?
Yeah, and that's not a grammatic mistake. This is not 40% growth over a couple of weeks. This is 40 times growth, the volume. I would have loved to sit here and tell you that it is going down, kind of coming back a little bit towards normal, and maybe it a little bit does that. We have seen those numbers go down a little bit towards the end of May and through June. And very unfortunately, those numbers are coming back again, roaring back in, I should say.
I mean, the numbers for telemedicine visits, because just the same other things. Are you talking about the virus or the telemedicine part?
Well, one of the ways to know that what you're doing is meaningful is to see the resemblance between where the virus is prevalent. What are the hotspots? What are the areas, the epicenters that are evolving? And then we have ways to actually track geographically how telehealth is being utilized. And unfortunately, there is a direct match. So in places where healthcare is both overwhelmed on one hand, because there's so many people with health concerns, and at the same time, in those places, usually the stay-at-home shelter-in-place orders are, the most strict. This kind of combination, this kind of a two-step punch, draws everything into telehealth, and we see this literally showing up in front of our screens, literally every day.
So how many telehealth visits are happening in the United States right now? If you can say how many you guys are doing, but how many in the aggregate are happening each day right now?
Well, I'll be the first to say, I think, we're one of the older companies, but we're in telehealth, but we're not the only one. And the funny thing about it is that telehealth has, over the last 2 months, has become a hodgepodge of a lot of different ways in which clinicians and patients are using technology to get in front of each other. And rightfully so. I think, the truth is that clinicians who have patients that they're responsible for are using everything from phone and FaceTime and Zoom and whatever, net meeting, whatever comes around, as well as proper telehealth infrastructure to get in front of them. So just like people are saying, you know, the testing reveals how many people have tested for COVID, but the actual number of COVID patients is much larger than what is documented. I think the same analogy is true for telehealth. We see millions of patients that are being seen through our platform, but the reality is that probably the number is actually much larger, as a lot of clinicians are using everything that's in their power
Right.
to practice their art with the patients that they're responsible for.
Of course, to do it right, you have to abide by HIPAA and all that stuff, which you know so much about.
Yeah.
But you know, one of the things that I was, you know, Techonomy has done a lot of work around health and technology in a number of recent years up until the present. And one of the things we've always been sort of distressed by is the barriers that continue to exist, which, you know, as you say, we've blown through them, but quickly remind us, what was holding this back before?
Well, I mean, it depends how far back do you want to go in time. But I would say that, you know, obviously when we started doing this, you know, we were the crazy people that said that healthcare can happen over technology. And the immediate objection came from the medical, you know, from the medical practice, from the medical institution, primarily represented by the medical boards, who said, how could you possibly take care of a patient without being able to physically examine them? Which is, you know, not a bad intention. It's really making sure that patients are going to be safe.
We should mention you are a doctor, by the way, so keep going.
Yes, that's right. But we've had, you know, the colorful stories of our beginning. You know, the first client, the first rollout that we had was in the state of Hawaii, with Blue Cross Blue Shield of Hawaii. And very famously, the day that we rolled out telehealth, the medical board of Hawaii that governs the licenses of physicians issued a public letter to all of the physicians of Hawaii saying, if you're going to do this Emerald thing, we're going to take your license away. That was day one of American Well.
Good, nice start.
Gray hair, you know, here and here and here. Kind of a good way for a company to start operating. But funnily enough, you know, like a lot of things in life, things don't end up exactly what they seem in the first moment. It actually created, interestingly, kind of a social uproar in the state of Hawaii, saying, why really? We have people who are at home on another island, you know, it's a archipelago islands, that need to fly over to Honolulu to get care. How could you possibly say that seeing their doctors through technology is worse than not seeing anybody at all? And long story short, the state senate of Hawaii, a couple of weeks later, passed a bill that actually said, we require that residents of the state of Hawaii will have access to telehealth. So this is a long story only to say that the first objection of the first couple of years was the physician side of things, the concern about the safety. The next wave, and that has gone away, you know, that has by now completely disappeared. You know, clinicians are very comfortable with telehealth. And then the next level was the economics of this thing. You know, if we're going to give everybody the opportunity, you know, at 9 o'clock in the evening to go on their phone, and if there's nothing good on television, they can just go in and see doctors. You know, that's entertaining, you know, to some degree. And they, nice people, doctors, they ask you how you feel and all that. So the health insurance companies were very concerned, not only them, but also Medicare and, you know, CHS were concerned that telehealth is going to increase the use of healthcare and will cost us a lot of money.
Heaven forbid people should be healthier, but go on, yeah.
Well, you can see the argument that it is so accessible that maybe people are going to abuse it. So there were a lot of, you know, it took a good number of years for us with our, you know, with our larger customers, with our larger payers to actually acquire the data that showed that people are not abusing telehealth. People actually respect the time of a clinician in front of them, and they don't just go in and, you know, for chit chat. And then I think the other piece of the puzzle has been really more about, so how do you scale this thing? And maybe I will just mention that as a last kind of big element of barrier that still exists, because as you know, healthcare in the United States is very, very much a state business. So you have to keep a license in a state in order to see patients in that state. You have to be credentialed with payers on one hand and with health systems on the other hand. There's a lot of rules in play, including all the way to the Social Security Act, that restrict how healthcare can be given, and it's very, very physically oriented. And some of these rules are still in play, and especially state licensure. which mean that even though we may be in a position where there's an area in the country that needs a lot of healthcare and is overwhelmed, and we have another area in the country that actually has a lot of clinician availability, right now, there is no way for us to use the technology to make those clinicians available to where they're needed. We don't have the ability to pool together, and that is still a very big barrier.
I know there were a fair number of rules, especially around paying, that were suspended sort of on an emergency basis in recent months. Are some of the ones you're talking about, some of the rules that are at least temporarily currently suspended?
So from a payment standpoint, yes, there's been a sea change during COVID, primarily on the area of Medicare, which is the biggest, health insurer in the country. And, in February, if we had this conversation, Medicare was very, very, very conservative, very stingy, more so than I think they really should have been in terms of what can be delivered through telehealth. To the point that most Medicare patients were actually not allowed or were not able to take advantage of telehealth, even though the commercial side of things, people under the age of 65 could really have almost, complete coverage for telehealth. In COVID, that has changed. And Medicare have said for a period of time during the emergency, we're going to cover pretty much anything that you can deliver as a clinician through telehealth. And that has opened the door for a lot of people to get healthcare they need. It's anybody's guess what's going to happen when the emergency thing is lifted. I think the reality is that we're probably going to find ourselves somewhere in between those two. But here's the thing. The truth is, it isn't really about the dollars. If you're an elder patient and during COVID, you found that you can engage your clinician without having to carry yourself out of bed, and if you're frail and sick and you have various conditions, and go to the office and stand in line and get appointments and everything else, if you found that a lot of the healthcare can come to you, how could you possibly tell a cancer patient, now that you have cared for them effectively through this technology, you know what, we're done, take the bus?
Yeah, well,
someone will do that.
It's interesting you mentioned cancer patients, because people that have other things wrong with them beside COVID have been some of the biggest losers during this period. And thank God that telehealth was there, because otherwise they would have gotten no care at all. And these are people who, in many cases, absolutely require ongoing consultation.
Yeah, I think that's the biggest misunderstanding about telehealth during COVID, is that people think that telehealth was used to treat COVID patients or to treat people that were concerned with COVID. And while that is definitely true, maybe luckily for us, still the people that were exposed to COVID represent a very, very small fraction of the people that have healthcare issues, and healthcare issues that are potentially as bad if you leave them untreated, and can hurt you, just as much as COVID can.
Yeah.
And the biggest volume of healthcare that we have seen done over telehealth is for that population, is for people with heart failure and cancer, and people who had surgery and are discharged to their home, and people who have renal failure, and I can go on and on and on. But it's really the biggest lessons out of COVID is that regular healthcare can be dealt with and can be helped by telehealth in enormous ways.
Okay.
COVID just started that revolution.
That's great. I want to do two more things before we wrap. I want you to talk about the future, and I want to talk a little bit about Amwell and Amwell's future. But you talk about how we don't really know what's going to happen with things like Medicare payments. But we do know that in a way the zeitgeist has shifted, right? I mean, both my wife and myself had never had a telehealth visit before the last few months, and now we do it, and we've done it multiple times. I think that's true probably, I would bet, for the majority of people on this Zoom. But let's just say COVID somehow was addressed, which frankly at the moment we can't even say, but really we go move to a post-COVID world. How do you think this will settle in, and what would be your dream scenario, and what do you think is the realistic scenario?
Well, I think in healthcare, the realistic scenario and the dream scenario should be the same one, because you want to be very safe about things that you do. But I would say this, look, healthcare is different than a lot of other industries, and nobody can argue otherwise. We probably in the US made it even more different than it needs to be, but that's a different story. But I would say that, you know, every other industry that we know has, in some cases, kind of reinvented itself around the notion that there is a balance between physical services and digital services. You know, the obvious example is retail, right? I mean, it's not that the stores disappeared, you know, and it's not that people don't go shopping and don't go into malls, but there is a healthy balance between online and physical retail. Now, not that healthcare is the same as retail, but the notion that, like every other industry, there is going to be a new balance between the buildings of healthcare, the offices of healthcare, the waiting rooms of healthcare, and the way in which clinicians and patients interact over technology. The moment that we embrace that, and it is inevitable, this has nothing to do with Amwell and its growth and whatever it is, this is inevitable in every industry. The moment we embrace that, we turn the corner from being defensive about it to saying, well, how can we use it? How can we, for example, and maybe if you talk about the ideal or where I would like things to be, I want to get to the point that when I grow old, I can reimagine how healthcare surrounds me where I want to be, which is in my home, not in the belly of the beast. I don't want to be hospitalized. I don't want to be in a skilled nursing facility or whatever it is. I want healthcare to come to me. If we can start a revolution of reimagining the healthcare experience using that balance, we as people are going to have a better life.
Right.
And that's my hope.
Well, it's so true that everybody was used to doing so many things digitally, and healthcare was the one major exception for most of us, which is one of the many things in a way that makes this one of the strange things about this quarantine is that in some weird way, we were actually ready to be at home, even though many of us didn't fully realize it. And you know, Zoom is one example, but the existence of a service like yours is another. Things that had been being built over many, many years suddenly were proven necessary, but they were there. And that's kind of miraculous in a certain way. Okay, quickly on Amwell itself. You raised an enormous amount of money. I almost said a shitload, and because this isn't anything public right now, I'll say that. You raised, what, over 190 million in a offering just recently, and you're gonna go public. So you've announced you're gonna go public in the not distant future, if I have it right. Talk about the company and what are your ambitions for it?
Well, you know, I think the one of the things that has been true about us from day one, and we are very lucky and very fortunate to continue to sustain and to continue to believe in, is that we are actually not the story. There's a lot of telehealth products out there, and they all have their heart in the right place. They all try to deliver value to a lot of people. I think our view of the world is that we need to become the infrastructure for traditional healthcare to happen over technology. This isn't about come to us and we'll deliver healthcare to you. This is about how can we allow the healthcare that you trust, whether it's Cleveland Clinic or whether it's Blue Cross Blue Shield or anybody else that carries and really worked, you know, in some cases generations to develop that credibility with you. How can we allow that interaction to spread its wing and happen over technology? Paradoxically, what that means is that you actually don't need to know anything about Amwell. You don't have to see the Amwell brand. It is the old Intel Inside, or whatever you want to call it, that allows healthcare, the traditional high quality healthcare, to be distributed over technology. And we become, you know, if we can help it, we become a switchboard under the hood that helps that, right, you know, to happen rather than a destination. I think that, and we've modeled and we've grown over the years to exactly do that. And you mentioned we work with a lot of payers and with a lot of health systems. And when they run telehealth through us, it's their brand, it's not ours. You know, 99% of the volume we do doesn't have the word Amwell on it at all. You won't even know it's us. I think that's the right way. I think that's success, because it means that what's good about healthcare can now through us happen through technology. Well, not an alternative, not a shadow world
That's a
an
very, very big picture, judicious answer. Thank you. But I mean, when you mentioned Intel Inside, and let's face it, it was something of a shadow brand for many years, although then they got big on their marketing. But people who invested in it did really well. So when are people going to be able to, people who've been impressed with you on this Zoom, when can they invest in Amwell?
David, and you know,
You're not going to tell us. Okay, that's all right.
all I can say is that we're very fortunate to be in a place where we deliver value, and it's a partnership of a lot of people, and hopefully it will be a partnership of many people, and I'll just leave it at that.
Okay, that's cool. Listen, Roy, thank you so much. This is really, the work you're doing is critical. And again, it's really fantastic that you had evolved the company to such capability before we had to use it so much as we have. So thank you for being here. Really appreciate it.
Thank you so much, David.